Welcome to this month's Friends You Keep. As they say, we are the average of the 5 people we spend the most time with. And at Erin Wellness, we believe that sustainable health and wellness is an accumulation of 5 pillars: the thoughts you think, the friends you keep, daily movement, nutrition, and lastly, supplementation. So each month we feature guests doing exceptional things that will hopefully inspire you to step into all you are destined to be. Hello, everyone, and welcome to the Friends You Keep today. Today, I'm excited. We have Dr. Catherine Multari with us. Hi, Catherine.
Hi, Erin.
So, Dr. Multari is a naturopathic physician at AlterEgo Health, an online clinic that specializes in menopause. This is a conversation a lot of you are going to be interested in. She is a Menopause Society Certified Practitioner and a Fellow of the American Board of Naturopathic Oncology. She delivers evidence-based, compassionate, and exceptional care to empower a woman's health journey. Her dedication and commitment to health and well-being of her patients has made her one of the most sought-after cancer and menopause practitioners in the Lower Mainland. So I'm really excited to dig into this conversation today. So again, thank you for being here and taking the time.
Yeah, it's my absolute pleasure. These are topics that I feel so passionate about. So anytime I get the opportunity to speak on them, whether it's in a podcast setting, in person, it honestly just fills my cup. So I'm happy to be here.
Awesome. Yay. Well, I definitely, when I do my seminars, I'm always, especially here in BC, I'm recommending AlterEgo to women who are looking for some sort of care in the midlife journey. And I recommend all women should have somebody who's supporting them and walking them through and giving them all the options. That's something I'm very passionate about. I think in our industry, especially the natural health, because I'm more natural health side, we tend to be like, there's always been this thing with the medical community about hormones and all that. And I'm very much about integration and about using whatever makes you feel your best. And if that's not a choice for you, then that's great. So there's some natural products that can, assist a bit. But
Yeah.
in that, I really am passionate about women having all the options presented to themselves so they can make an informed decision. So I know what you're doing, AlterEgo Health, is amazing in that because you guys are offering that to women. So, but before we dig into all that, why don't we talk a little bit about what brought you to being a naturopath? I mean, are you from BC? Kind of give us a little bit of the journey of Catherine.
Yeah, so I'm originally from Windsor, Ontario, which is where I grew up.
Ah,
So it's a small city in Ontario that's very blue collar automotive industry and very Western, I would say.
mhm.
So when I grew up, I always wanted to go into medicine and become a doctor. I just frankly didn't know naturopathic medicine existed. So it wasn't until I went away to university and my horizons were broadened that I realized I wanted to deliver medicine in a more comprehensive, holistic approach.
Yeah.
I wanted to be able to spend more time with my patients. So I still at the time was unfamiliar with naturopathic medicine. So I just had this idea that I was going to be a medical doctor that was just a little bit different until one of my friends in university finally said to me, Catherine, why not be a naturopathic doctor? That seems like what you're describing. And to which I replied, what's a naturopathic doctor? And then proceeded to look into
Uh,
it, saw, wow, this is kind of the job that I was describing. So that's how I got introduced to naturopathic medicine, and it was a fit from the start. And I would say every year I went through naturopathic medical school and then have been in practice, which is now strange to say, coming up on over a decade. Um,
wow.
it's every year has just felt more fulfilling and more like I'm on the right path. So
Hmm.
that's kind of how I got to where I am here. I did go to naturopathic medical school in Toronto, but always had, throughout that time, always had a desire to come out west. One, because of our scope of practice, it's so wide. So especially in the conversation of
Yes.
menopause, I can play a big part even of a patient's care and can kind
Mhm.
of truly be a primary care provider. We can order blood work, we can prescribe and refill medications. We can also do what naturopathic doctors do best, which is the integrative approach using supplements and lifestyle modifications alongside pharmaceuticals for best
Mhm.
outcomes. So I'm really able to use my skills to the greatest ability, which is one of the big
Yeah.
reasons that drew me to practice in BC.
No, I know. So every province, for those people who don't know, every province is different, correct? I know Alberta,
Yeah,
they cannot prescribe
correct.
they cannot just prescribe at all, correct? Is
Yeah,
that?
Alberta, yeah, naturopathic doctors don't have prescribing rights in Alberta. Ontario, they have prescribing rights, but it's very limited.
Yeah.
So BC by far in Canada It's naturopathic doctors are regulated, which is a good thing for the profession.
Yeah.
And we have a wide scope of practice. So, especially in today's day and age when primary care is hard to come by, it's
Hmm.
really rewarding to be able to help patients when access to care might be limited.
Yeah. Well, and so we're going to kind of dig right in. So, I mean, when we look at perimenopause and menopause, it's definitely having a moment. And I can definitely attest to it. And I do a lot of talking on it as well. But what do you think is the most important thing women in peri or menopause should focus on for their health? Is there one particular thing you can kind of really pinpoint that you think, advice wise, you would tell women?
I think one thing, advice wise, that I could tell individuals in perimenopause and menopause is, and actually, I think it kind of starts even before that, but really getting in tune with your body's natural
Mhm.
rhythms so that when you go through perimenopause, you can really self-advocate. I think that's one of the most important things. I know it's not, something to do treatment wise, but I think
Yeah.
patients oftentimes sometimes feel stuck, or sometimes they will explain symptoms to me but really diminish them, because I think
Mhm.
also as women we are strong individuals who are used to kind of forging on, which
Yeah.
is which is okay, but also having the self-awareness to say, you know, if I was this stressed out previously, I might not feel this anxious if this was 5 or 10 years ago. So, yes, there's stress in my life. Yes, I'm caring for both my kids and my aging parents. But, I had stress in my life 5 to 10 years ago and I didn't feel this physically anxious,
Yeah.
right? I had stress in my life previously, but I wasn't having insomnia. Like something is different here. So I
Mhm.
think just like really being very self-aware, I think is one of the best things that individuals can do
Yeah.
in this
No, I fully
transition.
agree with that too. I fully agree with you there. And so when we're looking at, because I think MHT is something I find when I'm in stores, because I go from health food store to health food store and I educate on my product line. And what I've been doing now, and whenever I do these aisle trainings, because I'll have like 2 to up to 7 people standing in the aisle with learning about air and wellness products. But a big part of my education I go through is talking about how it's MHT now, not HRT, right? Because a
Mhm.
lot of people don't know that. And they're like, oh, and a lot of people don't. And I mean, even in there's people who think that my products have hormone replacement in it or MHT. They're like, do you have hormones in there? I'm like, no, this is natural health. We're natural. That's different, right?
Mhm.
But in that, just telling people that it's now our definition for a hormone
Mhm.
therapy is MHT, menopausal hormone therapy, right?
Mhm.
Because it was such a big umbrella with HRT, and HRT is testosterone, birth control, transitioning, genders. Like it's such a broad scope that I think it's great we now do have the definition of menopausal hormone therapy. So it's not just like this big, huge thing. So when we're looking at menopausal hormone therapy, can you kind of go into the different forms? I know bioidentical, there's FDA approved, there's non FDA approved, there's synthetic, there's compounded. Like there's so many different things I think that women kind of get confused with. And a lot of that stems from, of course, the World Women's Health Initiative study that happened. So there's all this kind of, we shouldn't be on it because it causes breast cancer, and which ones are the ones we shouldn't be on. So can you kind of go in and kind of clear some of this up for the listeners?
Yeah, absolutely. And I'll try to do it as concisely as possible,
Yeah.
to be kind of simple. So I would say, yeah, MHT stands for menopause hormone therapy and is a sliver of the pie when we look at overall HRT, which is hormone replacement therapy, which
Yeah.
Aaron mentioned. So when we talk about MHT, it's using hormones to treat peri and menopausal symptoms. So within MHT, and if we're talking about the two female sex hormones, estrogen and progesterone, we can divide those into two categories, one being bioidentical, another being synthetic. So bioidentical would be an estrogen or progesterone that's most like what our bodies naturally produce. So bioidentical progesterone is called exactly that, progesterone. Bioidentical estrogen would be called estradiol. Those are what we naturally produce and what we can take as MHT. One important thing to note about bioidentical is oftentimes individuals confuse bioidentical with compounded. They think
Mhm.
bioidentical hormones have to be sent to a compounded pharmacy or some type of special pharmacy, but that's a common myth. Bioidentical hormones, estradiol and progesterone, are available in commercially available forms. So, for instance, progesterone, you can get progesterone at Shoppers Drug Mart, at London Drugs, at Save On Foods Pharmacy. Estradiol comes in the patch, the cream form. Those can be picked up at a regular pharmacy. Compounding pharmacies can also do those, but they're widely accessible. Then, when it comes to the synthetics, these oftentimes have different names. So a synthetic progesterone is oftentimes called progestins with a TINS ending. So progestins are synthetic versions of progesterone. The tricky part with both synthetic estrogen and synthetic progesterone is that sometimes they have more unwanted side effects as well as increased risk. So we think of birth control being one of those examples where birth control is either a combination or a standalone synthetic estrogen and progestin. And that's why sometimes birth control pills, for instance, can lead to extra water retention and unwanted side effects that you wouldn't expect. So I would say that's kind of the differentiating factor between bioidentical and synthetic. And then I think, yeah, and when it comes to estrogen, I think this is an important one too, is talking about whether estrogen is given topically or by mouth. Estrogen is by far safer when given topically. So estrogen is by far safer when given in either gel, cream, or patch form. The two main reasons, there's many reasons for this, but the two main reasons I like to highlight is one, topical estrogen is shown to lower triglyceride levels, whereas oral estrogen is shown to raise triglyceride levels. Triglycerides are one of those harmful types of cholesterol that increases your risk for plaque, atherosclerosis, and possible stroke. And then also following up on that is oral estrogen also increases your risk of stroke. It is a small increased risk, but it is there, whereas topical estrogen has neutral effect on stroke risk. So just today, I switched a patient from a topical estrogen, which was working well to manage her hot flashes and menopausal symptoms, to, I switched her from an oral estrogen to a topical estrogen.
Yeah. Well, especially heart disease is one of the number one killers for women. So we don't really want to increase any opportunity for heart issues at all.
Exactly. And the risk is low because, for instance, the risk with birth control for increasing clot is there as well. And we see in birth control the benefit for preventing unwanted pregnancy and other reasons to control heavy bleeding, control other gynecological concerns. The benefit outweighs the risk. But if we have an alternative that has pretty much no risk when we're looking at the same parameter, then to me, that's a no-brainer.
I want to kind of also so when people think, I think they think bioidentical as well. It's still made in a laboratory. So some people think that bioidentical means it's all natural, and it's like it's still made in a laboratory. Correct. So it still is synthetic to a certain degree. Correct. Right? Okay, yeah. Because I think sometimes people think it's all natural because it's bioidentical, and so it must be just like. So I think there's understanding that it still is made in a laboratory. It still is synthetic. It still is a pharmaceutical ingredient. Yeah. Okay.
Yeah, the bioidenticals are oftentimes made from plant products like yam or soy.
Yeah. Okay.
Oh, excuse me.
Okay.
Yeah,
Gotcha.
but it is still synthesized in a lab. Yeah.
Okay. So gotcha. Okay.
Still synthetic.
Now, obviously, I mean, now I believe now there's recognized, is there not like 103 symptoms that are now kind of recognized for like, so everything pretty well under the sun, whether it being ringing in your ears or dry eyes for vaginal dries, like goes on and on and on, which one of the things I kind of say, I'm like, well, of course, like estrogen is our mother hormone. Like that is of course, if you took away guys' testosterone, I mean, they go down a bit, but if we like sucked it all out, mind you, there'd be way more research and studies going on if that happened to men, but they would kind of the same thing. They'd be a complete mess, right? Midlife. So obviously the reason why women want to be using MHT in a combination, and this is not just pushing people to get MHT, it fully is a choice that you have, but I take progesterone myself. I use vaginal estrogen, and I also use testosterone. So I have those three, and I'll be adding estradiol once I get to that point. But I also take all of my supplements too. So it's all about, and I work out and I sleep and so it's all these things together. But when should a woman really start looking at using something like an MHT? Like when's the point where they're like, okay, I really need to go and talk. I mean, I think you should have a plan way before, but when
Yeah.
should they be like, hey, time is now to get on?
Yeah, I love that question. And I think it brings up another really important topic, which is like kind of like what is perimenopause? Because I
Mhm.
think one of the most common things I see in my practice of a gap that I fill is although I treat perimenopause and menopause, I tend to see more perimenopausal patients in my
Mhm.
practice. And as a naturopathic doctor, I truly believe the reason I'm seeing more perimenopausal than menopausal patients in my practice is not a generational thing, but more these patients are falling through the cracks. These patients are going to, because these are the stories that I'm hearing time and time again, these patients are presenting to their doctors, and I think their doctor is looking at their age as opposed to their symptoms and their labs, and treating them based on their age as opposed to
Mhm.
based on what's in front of them.
Yeah.
So menopause, average age of menopause is 51, very normal for menopause to happen between 45 to 55,
Yeah.
last menstrual period somewhere in there. Perimenopause can happen up to, and we have the research to show it, up to 10 to 15 years prior to menopause. So
Mhm.
that very safely brings us into 35 plus. So
Yeah.
women who are 35 to 45, if they're experiencing heart palpitations, trouble sleeping, increased anxiety, increased irritability, headaches, breast tenderness, night sweats, and we've done blood work to rule out thyroid concerns, low
Yeah.
iron, other things that could be causing these symptoms, and found that all of those are negative, then the patient is in perimenopause. It's a diagnosis of exclusion. They're in perimenopause just based on their age, and we need to be helping them.
Yeah.
And
100%.
how we help them, so getting to your question in terms of when individuals can turn to MHT, I do believe in perimenopause, especially early perimenopause. There's such a nervous system component to it, that I
Mhm.
do think that there's a role for diet, lifestyle supplementation. And I do think that diet, lifestyle, and supplementation can make the biggest impact in early
100%.
perimenopause, where patients'
100%.
symptoms of all of those things I mentioned can be very, very well controlled with
100%.
just diet, lifestyle, supplementation.
I agree too.
It's only until they get a certain point, a little bit further into mid to
Yeah.
late perimenopause, when the symptoms start peeking through, even despite the patient doing all the right things from a diet, lifestyle,
Yeah.
supplementation perspective, then we might consider menopause hormone therapy.
Well, that's kind of what I mean. When I was 35, I had kind of a health scare. My mom went through a horrific menopause. So she started on MHT at 49. She's 74, still on it. So don't stop it. Keep taking it. That's my advice. My mom feels great. Um, but in that, I have a product called Reclaim. I love that. I manage my stress. I train. I lift heavy. So doing all the right things. And it was last December because I started taking testosterone because I've always had very low testosterone. So this year I was down, I think like zero point 0.2. I was like so low. They're finally like, okay, you can have some testosterone. I'm like, thank you. I'm at like a 5 now. And I believe 7 is where women kind of lie at. So I've had libido for the first time in my life, which my new boyfriend's very grateful for. But nonetheless, I'm more decisive. And that's something else I've noticed. I can get a little snappy sometimes. That okay. My muscle is like maintaining and staying. It's a little easier for me to maintain my muscle. That's something else. But when we were checking my levels in December, my progesterone was in the tank. And it was during December at Christmas. I mean, I've done cognitive behavioral therapy. I was doing all,
Mhm.
I just, my anxiety was through the roof. Like I do everything, like I do the things, right? So, but I couldn't sleep no matter how much snooze I was taking, it was not working. And my anxiety, I just couldn't, I had like this overwhelming sense of anxiety. And when we got my labs back from my testosterone being higher, which was great. I mean, I put quite a bit on. I'm just like, like, don't even care when I do my testosterone. It is so much. But we've gotten the levels up, but my progesterone was in the tank. And so
Mhm.
that's when I started. And the next day, so that's when even when I'm talking to retailers as well, I'm like, if you have a woman coming in midlife and she has severe anxiety and she's not sleeping, sometimes that, L-theanine and some of these other natural herbs that we have to kind of relax somebody or to bring them down and calm them, it's not going to work. Like they really, if they're open to it, they should be talking to a doctor and
Yeah.
looking at something that will really support them. Because it was like next day, I slept like a baby, anxiety gone. Like it was incredible, right?
Mhm.
Like how much that changed. I still take my Reclaim and I still take my, my stress support and all the other things, magnesium, all the other things I have to have in my toolbox, but it just made such a profound difference overnight.
I love that example because it's treating it head on, right? Like you're
Yeah,
experiencing progesterone deficiency, and as much as we can, you're experiencing progesterone deficiency to a point where the only thing that's going to solve it is giving
is
you.
progesterone. It's
Yeah,
progesterone,
exactly.
and I think about so many women, and that's one of the things in my talks where I kind of talk about using all these things. And I think having these conversations is what I found being in retail space when I'm talking about progesterone. I talk about MHT. It's so fascinating to watch in our natural health space. Everybody kind of go like this, and they're all like, "What are you talking about?" And they're like, "You
Mhm.
take it." I'm like, "Yes, I do," and it's
Mhm.
okay. And it's, do you know what I mean? And it's about having these conversations and about supporting the retailer to have the conversation with women when they come in. So they
Mhm.
can say, actually, you can take natural supplements, but you really should go talk to your doctor and advocate for yourself and go in and
Mhm.
ask him for testing, whether or not he might want to give it to you, but you can still ask for it, right? And I
Yeah.
think there's something to be said about, I know that some doctors have said they don't like to test in perimenopause because they kind of know where you're at, but I think there's a great thing about women getting curious about their bodies, right? And being
Absolutely.
like, right, I know sometimes the labs will come in all over the place, but still, like, it's like being, I've been tested since I was 35. I've done it every several years. We've always kind of looked and see where my levels are because I have a really great doctor that way. But when he called me and he was like, Erin, your progesterone was like in the tank. And I'm like, okay. And he's like, I think it's time to get you some progesterone because this is probably why you're not sleeping and your anxiety's through the roof. And I'm like, oh, of course, you
Yeah.
know?
Symptoms
And
match
so,
perfectly. Yeah.
right. And what a difference that made. And yeah. And so I think that's something women need to, and the more we talk about it, I think that's the great thing is right now there is this whole conversation. And the more, I mean, I'm in a very different space being in retail, but the more I have, that's what I kind of feel, the more I'm having these conversations, even on the retail floor, it allows the retailers to also get more comfortable with having these conversations. Right. And then
Absolutely.
hopefully, right, makes their customers more comfortable having these conversations with them.
Yeah, and one thing I'd like to add to that is oftentimes when we look at the natural health space, oftentimes a lot of individuals, whether it be providers, patients, etc., are oftentimes drawn towards a more natural approach. And I think
Mhm.
that's kind of what's underlying here is a lot of
Yeah.
individuals who will go to a health food store, who will go even to a naturopathic doctor, might be into more of a natural approach and
Yeah.
taking something like a hormone therapy might seem a little bit foreign. However, it
Hmm.
truly is treating the cause. And so it actually
100%.
is a totally intuitive process. And the
Yeah.
interesting thing is, humans are one of the species that live well beyond the age of our reproductive system. So if
Yeah.
our menopause age is 51 and the average life expectancy is in the 70s, what percentage of our life are we living postmenopausal with
100%.
estrogen and progesterone
Yeah.
deficiency? Which that does not come without health risks. So the
100%.
loss of estrogen and progesterone, it's not a coincidence that
Yeah.
osteoporosis and heart disease and
Yes.
dementia happen postmenopausal. We are
Yeah.
at an increased risk of all three of those conditions if we are not taking
A
menopause
hundred
hormone
percent.
therapy.
Hundred
So
percent.
it's truly our bones, our brains, our heart, many of our vital organs are not
Mm.
intended to function without progesterone and estrogen. It doesn't need to be
Yeah.
the same level as we had
Yeah.
like prior to perimenopause, but even just using menopause hormone therapy to just top us up a little bit so that we're not symptomatic and our brain, bone, heart can function, I think is definitely worthwhile.
Yeah. I mean, my mom, it made a dramatic difference in her life, right? So, and I've watched her kind of go through it. And even, yeah, and even with her sleep, she still struggles with sleep a little bit. And I've finally convinced her because my mom is like, I'm only going to take what the doctor gives me. It's so funny because I'm, in my 20 years in this natural health industry. So I finally convinced her 2 months ago when I was in Calgary to try snooze with progesterone because she still wakes up at night and she'll take, and she
Mhm.
just has never. And so she came downstairs. She's like, oh, I had a full night's sleep. And I'm like, see, mom, you can take natural and take this stuff together. It's all about like, and so now she's bought her third bottle. I'm like, you don't have to buy snooze. I will mail you a bottle of my products. Okay. But now that's something she's kind of learned is that she can take both of these things together and actually, and I'm like, and mom, you need some magnesium. You should be on magnesium bisglycinate. You have a vitamin D. Like I go through, are you on a creatine? So I have her on this little toolbox for herself at 74. And she's always been very active, but now I'm like, I need you to train in the gym. Like
Mhm.
this is great. I know you love doing your walking and your pickleballing. That's great. But at least 3 times a week, I want you to go in and push some weights. And so that's
Hmm.
something else now she's committed to doing. So it's been interesting her at 74, kind of making these changes, but she is aging very powerfully because of that. And she starts, so there's no too late to start
Yeah,
either. Right.
absolutely.
So
No, yeah, no too late to start taking control of your health, and that's
exactly.
quite inspiring. And yeah, a
Yeah.
lot of my
And
patients inspire me in that sense.
so what, when we're looking at supplementation, what do you believe women should have in their toolbox? You're kind of nodding when I said magnesium and vitamin D. So I know those are like the building blocks.
Yeah, and I was just thinking, like, when it comes to sleep support, like menopause hormone therapy can do so much, but I think things that are in the snooze, the L-theanine, the magnesium, those are so helpful in terms of
Yeah.
nervous system support. And our nervous system is worn out day in
Hmm.
and day out from just being exposed to daily stressors, family, relationship, work stressors, is
Yeah.
going to deplete our nervous system. And although progesterone and estrogen help, I find herbal and nutrient support is a lot
Yeah.
more effective, and really builds the base of the pyramid
Yeah.
so that we can, like, yes, we can work up to
Yeah.
menopause hormone therapy, but you need to fill the base. And I find supplementation can be very, very helpful for that.
Yeah.
So supplementation is part of most of my plans.
I can imagine.
I'm not somebody to recommend like 20 different things. I like it to be specific for a patient, them
Yeah.
to know why they're taking something, them to feel the difference, like your
Hmm.
mom's experience. You should notice a difference when you're taking something. But in terms of large scale, I think certain things people should think about in the perimenopause menopause transition. I think the top two, one would be creatine. Just the research is so
Yes.
robust on it,
Yeah.
perimenopause and menopause when compared to other supplements. So we see the benefit on cognitive health, brain fog. We also see the benefit on muscle health, which helps with metabolism,
Hmm.
as well as other markers that work against metabolic disease, which is something we're kind of trying to avoid. So creatine's a big one, and then I think the other one would be vitamin D. Just its importance in terms of prevention of both cardiovascular disease as well as cancer, which are the top two
Yeah.
diseases that cause death.
Yeah.
So if we can be on something that can prevent our risk for cardiovascular disease and cancer, I think getting our vitamin D to adequate levels, especially since we live so far north of the equator, is a good
Yeah.
thing.
100%.
Then also vitamin D has an impact on mood, which we know one in every three individuals going through perimenopause and menopause will either have a new onset mental health condition
Yeah.
or worsening of an existent one. So vitamin D's impact on mood is important, and then its impact on the immune system. So
Yeah.
prevention of um, viruses, prevention of long viral illness. I think it's quite important. Yeah, so those
Yeah.
would be my top two that I think
Yeah.
population level,
Yeah.
it's hard to find patients who couldn't benefit from one of those
Yeah. I
and
agree.
quite
And then,
safe.
yeah. And then, I mean, too, with perimenopause is, and it's a basic of a protein. I mean, you don't necessarily have to
Oh,
supplement.
yes.
I'm a big believer. I like a whey protein because I like my whey smoothies, but and I talked, and they're it's so interesting because someone's like, yeah, like 30 grams a day, right? I'm like, no, like
30
30
pounds a
grams
day.
a
Oh
meal.
my
Yeah. And I'm
goodness.
like, no, 30 grams a meal. I said, and at night when you're hungry, this is an opportunity. If you are hungry, cottage cheese, Greek yogurt, protein smoothie, like
Yes,
protein before you go to bed. It's going to help stabilize blood sugar. And that can help also as well with those spikes that can happen in the middle of the night when you're waking up and you're not sure why you're waking up. And
that's
so
a great
making
point.
sure that you have that stability, and that's when your body's repairing. So giving
Mhm.
your body the nutrients that can do its job and start repairing while you're sleeping. So I remember just years ago when I talk about it and women be like, you can have a protein smoothie before bed. I'm like, yes. But then their mind, they're thinking, well, no, I'll have popcorn because it's like low in cal. It's 100 calories. I'm like, we're not, no, protein, protein, protein. It was like
Yeah.
protein, right? That's one of the big things that really helped too. Um, so I have some personal questions. Aside from
Mhm.
your practice, how do you find time for balance? Does that word exist for you?
It's challenging. The hardest thing for me personally about balance is I'm very like I do my job. I'm a naturopathic doctor because I want to help people.
Yeah,
And patients usually wait about a month to get in to see me. And I know patients who are really struggling, that month can seem like an eternity.
forever. Yeah.
So it's really hard for me to like just I want to, open my Saturdays and stay at the clinic till 8
Yeah.
p.m. to help get people in. But that is definitely a recipe for burnout. So it wouldn't actually be good for
Mhm.
anyone if I all of a sudden
Yeah.
couldn't practice. So the hardest thing about balance is balancing my clinical hours,
Hmm.
because I want to keep my clinical hours open enough so that I can see everyone I need to be able to see, but also enough time for rest so that I can show up and don't have to take any period of time off work.
Okay.
Um, I do love to travel, so I find that that's been very helpful in terms of booking intentional vacations, which I feel like that's been really helpful to. I've never actually felt burnt out from professional work to this point, which I feel really grateful to say. And I think part of that has been my passion for travel and always putting some type of trip on the books. That's a
Hmm.
break.
I love that. That's true. It's always something to look forward to, especially when you're going to go somewhere. And I mean, even when I do my like workations, it's so
Mhm.
as much as I'm on the road seeing stores all day, I come home to a hotel room and it's quiet. Or I can sit downstairs at the bar and have a drink and have like work on stuff and just I'm not at home. And when we're at home, where it's like laundry and
Yeah.
dogs and kids and so to me, even my little workation sometimes are like, oh, I get to go away and work. But it's like I get to get away from just life, right? And how busy life can be, right? Taking that time away from everything you got going on. So what is one thing you would tell your 20-year-old self?
For me personally, when I've always been very highly motivated,
Hmm.
but almost too much. Like I would say I would tell my 20-year-old self to enjoy the journey and to build strong relationships. I feel like
Hmm.
when I was quite young, I was so focused on the task that I was less focused on relationships, whether that be friendships, relationships with your family, etc.
Hmm.
And I think that in the grand scheme of life, I think the quality of your relationships really determines your
Yeah,
happiness. And I think
100%.
that's a really, really important aspect of life and health, like health beyond what we're
Hmm.
talking about.
Yeah.
And so, I mean, I'm fortunate to have great relationships in my life now, and to have supportive people who just, loved me regardless through that time. But
Hmm.
looking back, I think I was a little bit too focused and not enough focused on building strong relationships around me.
I love that. Well, that's the actual second. We have 5 pillars with the brand, and that's the thoughts you think, the friends you keep, daily movement, nutrition, and lastly, supplementation. Because we are there to supplement you. I don't have a magic pill. My boric acid is a magic pill, but that would be it. I always thought of my boric acid is about where I stop with the magic pills.
Yeah.
So what is your go-to treat? Do you have a favorite go-to treat you like to indulge in or you like to eat?
I think most commonly these days, especially in the summer, would be I don't tolerate dairy, but a dairy-free ice cream. I
Okay.
think
All right.
especially the summer months would be my
Do
go-to
you have a
treat.
flavor? Do you have a flavor you really like? Or you like
Um,
chocolate, vanilla,
Chocolate, yeah.
chocolate?
I'm a
Okay. All
chocolate
right.
person. Yeah.
What is your favorite swear word? And you can say it if you have a favorite swear word.
I think fuck is the only swear
I
word
think
I
fuck
ever
is
use.
it's a great
Like,
swear word. It seems
yeah,
to be with all the talk with all the little podcasts I've done, everybody fuck seems or motherfucker. People really
yeah, yeah. I'm like, do any swear words exist outside of that? That just is a
right.
classic and
And
just
they, and they actually say, I think there's research that shows saying the word fuck actually like releases a bit of like you're just oh, it takes away some of the stress.
yeah, I could totally see that. And I think I think that's actually a very healthy outlet.
Yeah.
Yeah.
See, you should start prescribing that too. With deal with stress, be like, okay, I want you to take a really great stress support product. I want you to do some meditation. I want you to say fuck a lot.
Yeah.
Just like,
Yeah. Get it
you're
out
like,
of the
okay,
system.
get it out of the system. What is your favorite book or podcast?
I would say, I mean, I don't have a truly like favorite book. My favorite book as of recently, I would say, that I continue to reference, is just a classic, The New Menopause by Mary Claire Haver.
Mm-hmm. I
I
like her.
like it for both. I actually recommend it for for both patients and practitioners alike. I think
Yep.
if every primary care provider read that book alone, even though it's patient
Mhm.
facing, I think if every primary care provider read that book alone, which is very easy to get through, we would have a much better system for all
Yeah.
patients.
Yeah.
Just understanding what you don't know.
Yeah.
and what symptoms, like you said, there's like so many symptoms related to perimenopause, which ones
Yeah.
those are. And even I'll have some students come in or other naturopathic doctors who haven't really done much training in menopause and say, I just want to start learning a bit about menopause. Where should I turn? And I've just recommended that book because it at least gets the
Yeah.
gears turning, and
Yeah.
is not so it's not so uh, thick and dense
Yeah.
that
Yeah.
somebody like, has a barrier to get through it. So yeah, I find
Yeah.
that a good one to
Yeah,
turn to.
she's done some great work. I mean, yeah, I have the utmost respect for her, obviously. She's done some great work, especially with bringing awareness and conversation and just being very open about things. So if people are looking to work with you, or please tell us, where can we find you? Where do we go?
Yeah, absolutely. So I am at AlterEgo Health, and that's where I see all of my perimenopause, menopause care. We are
Okay,
accepting new patients, so
love that.
happy to help patients there.
Okay, perfect. So alteregohealth.com, right? And then
Yes,
you guys are on Instagram as well at
we
Alter
are.
Ego Health. Okay,
Yeah.
good. All right. So
I
we will
believe
have that
Instagram
all in the
is
show.
at my alter ego health.
You're right. It is my Ulta. So I will put all of those in the show notes. And thank you so much for taking time. I know you have patients waiting for you, so I'm not going to keep you anymore. So thank you so much for being with us today. This has been amazing. And if you are looking for an amazing doctor, definitely go check out Dr. Multari. She's wonderful. And we will see you next time on The Friends You Keep. Thanks, everybody.
Thanks so much for having me.
Oh, thank you.